Can genetics cause high PSA levels? Have you ever wondered if your genes could play a role in your prostate-specific antigen levels? The answer is yes, genetics can influence these levels, and it is important to understand how. Prostate-specific antigen, or PSA, is a protein produced by the prostate gland. Doctors often measure PSA levels to help screen for prostate cancer. However, elevated PSA levels can occur for many reasons, not just cancer. These reasons include prostate inflammation, benign prostatic hyperplasia, or BPH, infections, age, and even the size of the prostate. Research has shown that genetics can cause variations in PSA levels that are independent of prostate cancer. In fact, scientists have identified numerous genetic variants that affect an individual's baseline PSA level. These inherited factors can lead to naturally higher or lower PSA levels without indicating the presence of cancer. Large studies involving tens of thousands of men without prostate cancer have found over 100 genetic variants associated with PSA levels. This means that genetics can explain a significant portion of the natural differences in PSA levels among individuals. For instance, a method called a polygenic score combines these genetic variants to predict about 10% of the variation in PSA levels, especially among men of European ancestry. This means that if you have a family history of high PSA levels, it might not be solely due to cancer but rather genetic predisposition. Adjusting PSA test results based on a man's unique genetic profile can improve the accuracy of prostate cancer screening. By accounting for these inherited variations, healthcare providers can better distinguish between PSA elevations caused by genetics and those that are more likely due to cancer. This genetic correction can reduce unnecessary biopsies and help identify aggressive prostate cancers more effectively. In summary, while elevated PSA levels can indicate prostate cancer, it is crucial to recognize that inherited genetic differences also contribute to these levels. Understanding and adjusting for these genetic influences can enhance the clinical utility of PSA testing. This approach leads to more personalized and accurate prostate cancer screening and diagnosis. It is important to remember that this does not replace standard medical evaluation but rather complements it by providing a clearer interpretation of PSA results. Always consult with healthcare professionals for personalized advice regarding PSA levels and prostate health.